It's Health View on your talk station, News Talk 640 WFNC.
And welcome back to Health View. This is Dr. Angela Ruff, and again, our guest this morning is Dr. Wendy Jones, who is an OBGYN with Women's Wellness Center. And what's the phone number for y'all's office?
910-323-3301.
Okay. And I asked you during the break if you have to be referred by a physician to see you, and y'all don't.
No.
Okay. Well,
not.
super. So anytime that you guys have questions or would be interested, if you don't have a doctor, please give them a call, and they'll be happy to get you checked out. So
Absolutely.
Well, good. Now, we were talking a little bit before the break. Boy, the really important thing, if you're thinking of conceiving, it's really important to get a good physical, get a checkup. There might be, you may have diabetes, you may have high blood pressure. There might be some things going on with yourself that could put you in danger or even your baby in danger that you just don't know. So you need to get a really good checkup first.
That is absolutely true. The best thing you can do is to come in preconceptually, have a complete physical, have a pap smear. Let's look at whether you have any of those chronic medical conditions that could be better controlled prior to attempting pregnancy, and looking at some of say if you had, say, a smoking habit that perhaps we needed to get you to try and quit smoking prior to attempting pregnancy, or if you're on some medications that might be considered teratogenic in pregnancy, it might be that we could find something to control you before that becomes an issue for you during a pregnancy.
Yeah. So a lot of things that we can hopefully plan for. Now, and so making the appointment, let me ask you this. I know we've talked a lot about women and their advanced stage and some complications, potential complications that can happen. Does it matter how old the guy is?
Male fertility does decrease with age as well, but it doesn't seem to have quite the same effect as it does with women. But yes, there are some genetic syndromes that are more likely if the man is of a later age.
Wow, yeah. So I didn't realize that. So it matters for
both partners, absolutely.
Both partners. Okay, all right. So now we know. So, so you've made the decision. You've had your prenatal preconception appointment. So, how often do women need to be seen by the OBGYN while they're going through their pregnancy? What's the typical follow-up?
In the first trimester, we in general would see patients every 4 weeks. If they have some chronic medical condition or some complication of pregnancy, then we might see them more frequently than that, especially while we're trying to get good control over that. Say if the person had underlying diabetes, we might actually see them once a week or once every 2 weeks to make sure we had optimal control during that first trimester of their diabetes.
Right.
But in general, it's 4 weeks, every 4 weeks, until you're about 28 weeks gestation. At that point, we would typically see patients every 2 weeks. And then at about 35 weeks, we start to see them every week because things tend to happen fast at that time.
I hear you. So when you're trying to predict when their delivery date is, how close is that? I mean, how accurate can you be?
Fortunately, most of our patients present early in their pregnancy, and they come in early for prenatal care. In our practice, at their first OB visit, we will do a quick ultrasound to assess the crown rump length of the fetus.
That's cheating.
That is cheating. And we will compare that to their date of their last menstrual period. And that will pretty accurately, usually within a week, plus or minus, determine what their delivery date would be.
I see. Okay. So y'all can pretty much get it
pretty close. Most of the time, yes.
That's right. So we talked earlier about, you talked about gaining weight, healthy. If you are pretty overweight beforehand, you may not need to gain any weight. So what do you have some suggestions for women who, I hear you get extra hungry when you're pregnant. Is that true?
For some women, that is true. just being aware of your portion size, I think, is important, whether you're pregnant or not pregnant. And in pregnancy, just making sure that you're not eating more than you normally would at other times. The other thing that tends to happen as women get into their third trimester and they start to get low back pain and they have all those physical changes from carrying the baby, they frequently will become less active. So it may be that in the evenings where they used to come home from work and go for a walk or walk the dog or go out to the mall or go shopping, they come home and then the inclination is to sit more on the couch and so you need to make sure that you continue to stay as active as you normally are and continue to have the same eating habits that you normally do.
Right. So you're burning less calories and when you're being a couch potato.
Absolutely.
Okay. So how about, is it safe for women, say if you're a jogger, is it safe for them to still run? And if so, how long can they still go jogging?
It is safe for you to exercise in pregnancy. We would typically recommend that you wouldn't start a new rigorous exercise program when you're pregnant. It's best if it's something that you were already in the habit of doing. And patients can exercise, right up until the time that they're going to deliver. One thing to consider is that when you're in your third trimester, your center of gravity is different. You tend to be a little bit clumsier. And so, the last thing you want is for your patient to end up on crutches because they've twisted their ankle doing something like that. So they just have to be aware that you are a little bit clumsier when you're pregnant, and so you may not want to do step aerobics in your third trimester. Something low impact like swimming or fast-paced walking might be a better form of exercise for someone at that stage in their pregnancy.
Sure. Okay. Well, good advice.
Thank you.
And maybe you could talk a little bit about some of the this is going on to another subject, but there is a vaccine that's available and relatively recently. Is it just this year that it became available?
It is.
Okay, well that's pretty soon.
Actually, excuse me, I think it was last year.
Last year?
Yeah, I think it was last year. A couple years.
And,
it's been out a couple years.
Okay. But the vaccine for, I guess it's just vaginal warts. So...
it's a vaccination called Gardasil that is for human papillomavirus. Human papillomavirus is the most common STD. And there are about 100 types of human papillomavirus.
Wow.
Some of the most common strains of human papillomavirus cause abnormal pap smears or dysplasia.
Right.
Precancerous cells on the cervix. And ultimately, if undetected, can lead to cervical cancer. The other strains of HPV can cause genital warts or condyloma. The vaccination that was created only covers 4 strains of those 100 that I told you about of human papillomavirus, but it covers the 4, 2 of the most commonly associated with genital warts and 2 of the most commonly associated with aggressive squamous cell cervical cancers. And so having that 3 vaccination series, and it's for women between the ages of 9 and 26. It's 3 vaccinations that they would get in a 6-month period of time, and that will lower their risk. I do want to make sure that we say that this does not completely take away their risk of cervical cancer or of genital warts, and it would still obviously be very important for that person to continue to get their pap smears on an annual basis.
Right.
But it does lower the risk, and I think in the future that we will see a reduction in certain forms of cervical cancer because of this vaccination.
Yeah. Well, that's great, and maybe even eventually down the line, maybe the vaccine can cover more than just 4 of the strains, so that's probably hopefully possible in the future. But no, I think that's great that it's available. I know in the news lately there's been a lot of talk about some of the group of population feels like the vaccines for kids are not safe or could cause some autism. But boy, it's definitely been medically proven how the vaccines have helped kids avoid polio, measles, just a ton of things that maybe our parents went through and lost a lot of lives, because of this.
If you look at those numbers recently, you do see that there is a rise in things like measles across certain states that we're seeing because of that trend.
Probably California.
Mm-hmm.
Yeah. So, but it's a shame. I think there's some information that's getting out to the public that sounds scary, and unfortunately, I think it's going to cause a lot of damaging information by the time that this thing comes full circle. Mm-hmm. It'd be too late for a lot of people. So, so that's my 2 cents worth. You can email the hate mail to to WFNC. So, but hopefully some more medically tested information will come out to substantiate the effectiveness of the vaccines. But I think it's great that they're offering this vaccine for this virus. It's one more way to protect women, I think, from cervical cancer. So that's great.
It is great.
Yeah.
It is great. Right now, just to let the listening audience know, a lot of insurance companies are just beginning to get on board with coverage of that vaccine. So if that's something that you're interested in, either for yourself or for your daughter, you may want to check with your insurance carrier and see if that would be covered. If it's not covered this year, it may be that you may want to give it a little bit more time because it is a relatively new vaccine. More and more companies are coming on board with coverage of that.
Right. And I think they've emphasized it's important that you get the vaccine before you become sexually active, because the partner or whatever may have no clue that they are carrying this virus.
Yes.
So it can be a very silent virus, and they can unwittingly spread this. Is that why you guys have the cutoff being at, was it age 28?
26, 9 to 26. And it may be with more recent data that age gets extended. They're doing the studies now, but the studies that were initially done on the vaccine series, the group that it included was to the age of 26, and because that's what's known because of the research that's been done thus far, that's where the age limit is at the present time. But it may be that changes in the future.
Sure. And especially some women actually may be waiting till marriage, and a lot of women are waiting till later to marry. So so maybe that would still keep them covered, because as I understand it, if you already have been exposed to this, it won't reverse it. It's just a vaccine if you have not been exposed to this virus.
Yes, it's definitely for people that have not been exposed.
I see. Yeah. Now, is there a way that y'all can tell? Does the Pap smear, does that show if somebody has been exposed to this already? Say if they want to get this vaccine, they're under the age of 26, but they've already been sexually active. If they had a Pap smear, would that pretty much let them know if they have been exposed to this, so they can still be a candidate for this vaccine?
The Pap smear does detect some strains of human papillomavirus, and so you could potentially test for that with the Pap smear. Because that vaccine only covers 4 of the strains, it's hard to know which strains you may or may not have already been exposed to in the past if you've already been sexually active. And so all that data is relatively new, but we do think it would still be a benefit if you are between the ages of 9 and 26, even if you have been sexually active.
Right. Okay.
Because you may not have acquired those particular strains of HPV.
Right. Right. And even if you acquired one, there's potentially 3 more.
3 more that may be benefited by the vaccine.
Right. Right. Okay. But there is treatments for this if they do end up with this virus.
Yes.
So it is curable.
Yes.
Okay.
Well, curable in the sense that you can take care of the symptoms that would present. For example, if they develop dysplasia, we would want to take care of that before it has time to progress to anything such as a cervical cancer.
Right.
Frequently, HPV can be detected immunologically in your bloodstream. You can tell that someone's been exposed even when they're elderly. Most of us, by the time we're elderly, probably about 70 to 80% of us have already in the past been exposed to HPV at some point in our life.
Right. Well, good test to have.
It is.
We're going to take a quick break, and when we get back, we will learn more good choices to make in our lives for healthy female choices. You're listening to WFNC News Talk 640. This is Dr. Angela Ruff.